Hey, what's up everybody? This is Dr. Andrew Kim, MD. I'm a board-certified psychiatrist, and today we're going to be talking about esketamine for depression. So esketamine is a nasal spray version of ketamine, basically. Now, ketamine has been a hot topic of discussion for the last few years in the field of psychiatry and mental health for treating challenging to treat depression. Probably the topic that's a little bit less well known is Esketamine, which is a nasal spray version, which is what we'll be reviewing today. What is it for? How is it different than regular ketamine? Who should be using it? All those different topics and a general broad overview. Now, before we go further, I need to give a few disclaimers today. Usually I'm not long-winded about it, but today I need to be. Disclaimer number one. I used to be a principal investigator. That means the physician who's overseeing a research study at a research center for the clinical trials that led to the FDA approval of intranasal spray esketamine, or Spravato. So I was one of the physicians involved in the research leading to FDA approval. All right, that's a good thing. I have firsthand experience. I'm not just reading off some Wikipedia page. I'm used to prescribing, overseeing the safety monitoring. I understand the side effects. I collected the side effects that led to all the laundry list of things that you see in the insert. Okay. Now, at the time of recording this video, my second disclaimer is I am on the Speakers Bureau for Johnson & Johnson, who owns the patent to Spravato, or intranasal spray esketamine. Now, that means I get paid as a speaker to go around the country to give talks to hospitals, clinics, clinicians across the country when I'm speaking for the Speakers Bureau. This video has nothing to do with Johnson & Johnson. This is not sponsored by them. The thoughts in these videos are my own personal opinions. This is on my YouTube page, Dr. Andrew Kim, MD. So I get to speak freely, openly. I'm not reading off of a script, and I get to share my own honest opinions about everything. Okay? And thirdly, most importantly, I am not your physician. This video is for informational purposes only. For personalized medical advice, please seek the guidance of your own physician. This is for education. So first of all, what is intranasal esketamine? When people hear the word ketamine, usually you think a couple things. Number one, well, ketamine is a street drug that can be abused to experience dissociation. True. Or number two, they say isn't ketamine an anesthesia agent? Don't people use that to be put under for surgery at times? Yes. Ketamine has traditionally been used as an anesthesia agent. Now, over the past decade, ketamine at lower doses has also been used to treat difficult to treat or challenging cases of depression. And is usually delivered intravenously, or IV, meaning they hook it up into an IV bag. They have an IV line, they connect it to your vein, and it's administered through your vein, IV ketamine. And by now, some of you probably have already heard radio ads or seen social media ads about ketamine clinics that are offering this treatment across the country. Now, to be clear, look, I believe in the science of intravenous ketamine. I think it's a viable option to treat challenging to treat depression, but technically speaking, it's not FDA approved. So intranasal esketamine is the enantiomer, or a variation of ketamine. The potency is a little different, so it can actually be absorbed much better in the nasal passages. So intranasal esketamine, or it goes by the brand name Spravato, is FDA approved. So this is FDA approved for a couple of indications for depression. And because it is FDA approved, there is a chance that insurance may cover this. So it's a little bit more viable for accessibility sometimes when insurance can pay for part of it. And some people are a little bit averse to getting hooked up to an IV, and it may be a little bit less scary to take something with a intranasal device. It almost looks like kind of your Flonase device that you take for allergies. So that is the difference between esketamine and ketamine. So how is ketamine any different than all of those other standard antidepressants? And when I say standard antidepressants, most people in America are familiar with SSRIs, selective serotonin reuptake inhibitors, and I've done a few videos on this already. These are household names like your Prozacs, your Lexapros, your Zolofts. These are medications that modify serotonin to some degree. Okay? And there are multiple variations of SSRIs, and there are even more variations where they affect not only serotonin, but other neurotransmitters like norepinephrine and dopamine. Now, interestingly, both IV ketamine and intranasal esketamine are not SSRIs. So they're not SSRIs. So for the first time in many decades, we have what's called a novel or new approach to trying to address clinical depression. This is an oversimplification because we could speak 3 hours on the theories of how ketamine-based treatments work. But in simplicity, we believe that ketamine or esketamine impact the glutamate system of the brain. So we're stepping outside the box of trying to alter serotonin, and we're now focusing on a new pathway called glutamate. So this is, bottom line, the point I'm trying to make is this is a novel, new approach with a different mechanism of action. Okay? Now, interestingly, because of that, there are also somewhat different timelines of response. Traditionally, when we have someone on an effective dose of an SSRI, we want to give it about 6 or 8 weeks of observation to know if that particular dose is or isn't going to be effective. Where with ketamine-based treatments, oftentimes we can make that determination in about 4 weeks. Probably a little bit faster even with the IV version, but with the nasal spray version we're talking about today, in about 4 weeks we can determine is someone a responder, remitter, or non-responder. So who is esketamine indicated for, and would it be a right fit for me? So let's just go over the 2 FDA-approved indications for esketamine. Number 1, the first FDA-approved indication is for adult patients who have major depressive disorder, which is a form of clinical depression, and also known to have what is called treatment-resistant depression, TRD. So it's a subtype of depression, of MDD, that is a little bit more difficult to treat. How do we define this term? What is the definition of treatment-resistant depression? First off, I want to be clear. There is no universally accepted definition, so this is somewhat of an arbitrary designation. But right now, the FDA, clinical research standards in America, we define someone as having TRD if they have not responded to at least 2 adequate courses of antidepressants in their current episode of depression. So let's say I started having my current episode of depression from 6 months ago to present time, and I tried an adequate dose of Prozac, I tried an adequate dose of Cymbalta, neither worked. Technically or theoretically, I would meet this definition of TRD. So the other important piece of that FDA indication is that the nasal spray esketamine is supposed to be used together in conjunction with another FDA-approved antidepressant, so to be used in combination rather than by itself. Okay? The second definition, or the second indication for FDA approval, are for patients who have major depressive disorder, so clinical depression, who also have suicidal thoughts or suicidal ideations or suicidal behaviors. So kind of a higher risk population, patients who are depressed, meet the criteria for MDD, but also are suicidal. Now, you might say, well, isn't that a lot of patients with MDD? Yeah, you're correct. But here's the weird part, okay? If you actually want to know, again, I've been a clinical principal investigator in research trial, over 100 trials that I've worked in. I don't know if you realize it, but the vast majority of the antidepressants that are on the market today, when they were studied in order to get FDA approval, they all excluded patients who were suicidal from their clinical study. So if you tried to become a research volunteer and wanted to be a research participant in those depression studies, and you said, not only am I sad and having insomnia issues and hopelessness, I'm suicidal. I may actually go end my life, hurt myself. You are basically automatically excluded from those studies. So interestingly, even though as psychiatrists we use those meds and we've used them for decades, we've generalized the data from a data set of people who actually were not suicidal. Makes you stop and think. So it's important to realize that this has been tested and studied, not just in clinical depression, but almost a higher risk population as well. So the next question is, how and where can I access esketamine treatments, this nasal spray? First and foremost, I think the clearest thing I want to get across is this is not something that your doctor can prescribe you and then you can simply go pick up at CVS, Walgreens, your local pharmacy. Esketamine is considered a controlled substance, meaning there is some potential abuse potential for this medication. So because of that, it's highly regulated by the DEA, and it will only be dispensed and administered at specific esketamine-trained clinics or hospitals, okay? So basically, you would need a referral from your psychiatrist or primary care doctor, or self-refer yourself and go through the intake process at a private practice or a hospital office that performs esketamine treatments. That is the only way to get it. You won't be able to simply pick it up from the pharmacy. Well, here's the reason why that you can't take this at home by yourself unsupervised. Every time that you receive a dose of this nasal spray, you have to be monitored for at least 2 hours. Yes, you heard me clearly, for at least 2 hours by medical staff after receiving this. This is an FDA requirement. So there are potential side effects of sedation, meaning feeling very tired, dissociation, which I'll define for you later, even risks of respiratory depression. So because of these things, and because it is a controlled substance, and we want to make sure that people aren't going to be abusing this, this is why you do have to be monitored for at least 2 hours after every single dose that you get, okay? You're not allowed to drive on the day of dosing after you receive a dose. So the day of a treatment or a day when you receive the dose, you can't be driving that day, okay? So you're going to have to arrange for transportation. So here's what to expect when you go through the intake process at a treatment center. Number one, typically you're referred there by one of your own doctors, or you are self-referring yourself because you found a treatment center on your own. Number two, usually the first visit is not the visit where you're going to get a treatment or a dose. Typically you will go through an interview process, some form of a interview, ideally with a psychiatrist, to better understand your depression, to collect information to see how to coordinate with your outpatient psychiatrist or primary care doctor to get more information from someone who knows you better, to make sure that you are an appropriate candidate for Spravato, okay? Number three, let's say it's determined you are a good candidate and you're going to move forward, then you would return to get your initial treatment. Now, in the beginning, in month number one, you would go into the treatment center for 2 treatments per week for 4 weeks. So a grand total of 8 doses of the nasal spray over the course of a month. And yes, again, being monitored for 2 hours after each dose every single time. Finally, basically at the end of that 1 month, a decision needs to be made. And 1 month is adequate, where you can determine, are you an individual who is getting a good response, an amazing response, a partial response, or marginal at best? Because you hit a fork in the road to determine, does it make sense for you as an individual to move on to maintenance treatment, ongoing treatments to maintain the benefit, or are the benefits marginal, or there are none, and maybe a decision needs to be made to stop the treatment at that time. Now, the next question I get from patients is, well, if I got a good response and the side effects are tolerable, how many more treatments will I need? Does it make sense to get ongoing treatments of this nasal spray? Well, again, it will be case by case, but if someone has gotten benefit from that first month of treatment, getting 2 treatments per week for 4 weeks, typically the next phase of treatment for those who are going to do maintenance is about 1 treatment per week for the next month, in month number 2. And then after that, we typically tailor or customize the frequency to either stay at once a week, maybe go once every 2 weeks, but there are cases where we go even longer, even sometimes once a month. Is there benefit? Is there evidence of benefit that for those who did well in the first month of treatment, that it benefits them to continue on maintenance treatment? Yes, there have been studies done on the maintenance of effect, and it seems that for those who respond in the short term, in the first month, there does seem to be benefit to continue on maintenance treatment. There seems to be a reduced risk of relapse back into the worst of their depression. And even if a relapse were to occur, there seems to be a delay in onset. It would take longer for symptoms to creep back in compared to a group that did well in month 1 and decided to stop their treatment. So there is some evidence to support the use beyond month 1. Now, what kind of side effects should I expect from something like esketamine? there is a laundry list of side effects. So I'm going to list some of the common ones and some of the ones that led to the rationale of why you have to be monitored for at least 2 hours. Okay. Now, one thing that I do want to emphasize that is very fascinating with esketamine is that the vast majority, and I can actually say this very confidently, the vast majority of the side effects that you would even find in the fine print of a package insert tend to be day of treatment side effects, and most resolve on that same day. And I would actually say more than 90% even resolve within the 2-hour time frame while you're being monitored at the clinic. So rather short term. Again, I don't want to oversell that to say that there aren't patients who have side effects that go beyond the day of dosing. Of course there are, but the majority actually do resolve on the day of dosing and even within that 2-hour window. So the ones I want to highlight today, number one, sedation or drowsiness, okay? That's part of the reason why you need to be monitored, to make sure that you get through the worst of that, and the reason that you can't drive on the day of dosing. So I would say easily over half the patients who receive esketamine will experience some level of sedation. Number two, nausea is pretty common as well. Number three, there can be a temporary increase in blood pressure, and that's why you will get your blood pressure monitored when you are at the treatment center to make sure that your blood pressure is nearly back at your baseline, or trending back that way before you leave. Okay? That doesn't mean that folks who have hypertension can't receive Spravato or esketamine treatments, but you do want your hypertension issues to be under control before you embark treatment with esketamine. Okay? Number four, dissociation. This is the one that gets talked about a lot. For those of you who are not familiar with dissociation, this includes a variety of different symptoms. It's a broad category, actually. You can have sensory changes in how you experience your visual fields, sounds, so colors may seem different, brighter, dimmer, sounds might seem louder, softer, your sense of time could be warped. You might feel like your environment is unreal, surreal, like you're in a dream. You might feel detached from yourself. These are a few examples of dissociation. And again, I would say easily more than half, if not close to 2/3 or more of patients experience some level of dissociation. Again, vast majority resolve before you leave the treatment center. Okay? And finally, just like all antidepressant class medications, esketamine also carries a black box warning from the FDA, similar to all the other black box warnings of antidepressants, that there could be an increased risk of suicidal thoughts in young adults. Is this going to be covered by my insurance? Look, I can't guarantee it will or won't. There's so many insurance plans out there, but what I can say is there is a potential it may be covered because, yes, intranasal or the nasal spray version of esketamine is FDA approved as a treatment for those two indications. There may be a pathway. You can get some of this, or maybe hopefully most of it, covered by your insurance. Intravenous or IV ketamine, which has been around longer, sadly tends to be a cash-only process. Again, this is not about comparing IV and nasal spray to say one's better than the other. I'm just stating fact. I believe in IV ketamine. But I also know for a fact, because it's not FDA approved, most insurances will not cover it. And because of that, you do have to pay out of pocket for the most part. All right. So hopefully you have a form of insurance that may offer a pathway, even if you have to argue with paperwork, phone calls, to hopefully get this approved. So in summary, is ketamine and esketamine, are they new, exciting, novel options to treat challenging to treat depression? Yes. Are they silver bullets that are going to be cures for everybody? No, of course not. Nothing is. Is it a step forward in science? Yes. Is it still barely adopted by patients and clinicians in the US? Yes. Sadly, a minuscule amount of patients have received this form of treatment. Why? Fears, myths, misconceptions, price vulturing, time commitments, all of the above are likely factors. Okay? I'm going to end with this. Okay? For patients who are worried and focused about the time commitment involved with trying this approach, if your clinician thinks it's right for you, I know that's a lot of time. 2 hours a week, twice a week for a month. Okay? 16 hours in a month minimum. Let's throw in travel, the time for that initial interview to even vet you. So let's say 20 hours of your life in the first month of treatment. I get it. So you're saying to yourself, I got a job, I got school, how can I fit this in? The only comment I give my patients who, when I determine I think they're a good candidate and I hear that commentary, I say, you are worth 20 hours of investment. And they look at me and say, what do you mean, Dr. Kim? And I say, you are worth 20 hours, aren't you? How much time has depression stolen from you? Stolen from you and your loved ones? Time laying in bed, staring at the ceiling. Oversleeping, not sleeping. Time spent in isolation. Time spent ruminating on dark, morbid thoughts. In 1 year, let's say you've been depressed for 1 continuous year. Depression has stolen away 8,766 hours from you. You've been depressed for 2 years. Depression has stolen away 17,000 hours or more from you. You are worth a 20-hour investment. So I hope that you found this overview helpful. Again, this was rapid fire because I wanted to hit the highlights just so you have a basic preliminary understanding of what intranasal spray esketamine is about. If you want me to dive into more nuance about one of these sections, let me know which of those questions or topics you want me to do a separate follow-up video on. Thank you again. Again, Dr. Andrew Kim. Hope you are all doing well.